Elsewhere across Victoria today, police launched one of the biggest anti-drugs operations the state has ever seen. More than 600 officers raided a cannabis and heroin syndicate that police allege made $400 million in just the past 2 years. But as police were claiming victory in that battle, a visiting expert on narcotics law was telling the National Press Club that the wider international war on drugs can't be won. Ethan Nadelmann heads the George Soros-funded Drug Policy Alliance in New York. He says that privately, more and more politicians, police and health authorities know prohibition of drugs can't succeed and in fact only benefits criminals. And he argues a move to decriminalise soft drugs and regulate supply of narcotics in countries like Australia is only a matter of time. I spoke to Ethan Nadelmann in Sydney. Ethan Nadelmann, who is winning the drug war? Is it in fact winnable?
There's probably only two groups that are really benefiting from the drug war these days. On the one hand, you have all the criminal organizations in Mexico and Afghanistan and Australia and the United States that are making billions and billions of dollars, and so long as they're not getting caught or going to prison, they're benefiting. And the other group that's benefiting, essentially, is the prison industrial complex. It's the hundreds of thousands, the millions of people around the world getting paid to enforce these laws, getting paid to put people in prison, getting paid, basically to keep arresting people in what's a bottomless pit. And in a way, what's happened over the last few decades is that the organized criminals keep making more and more money, the law enforcement establishment keeps getting bigger and bigger, they're benefiting, and everybody else is worse off.
You make it sound very easy, legally regulated and everything will be fine. But what is your plan? How easy would that be?
Well, I think the first thing is we need to transform the nature of the debate. I mean, so much of the debate in your country and mine is about which new law enforcement approach might work better. But I think the really important debate is between those people who would say, let's legalize the whole shebang, and those people who say, let's not legalize, but we need a much more sensible public health policy, one that focuses on reducing the death, the disease, the crime, and suffering associated both with drugs and with our failed prohibitionist policies. Then you can ask, what are the best policies that we could have to reduce the harms of drugs? And with that, I would say, first of all, with cannabis, take cannabis out of the criminal justice system. I mean, let's face it, we've justified the laws against marijuana forever and ever as some great big child protection act, when everybody knows that the people who have the best access to marijuana are, in fact, young people. With respect to the harder drugs, heroin, cocaine, especially with heroin, I would say let's allow the hardcore addicts, the people who are committed to using these drugs, who are going to get them from the black market no matter what we do, allow them to obtain it from legal sources, from clinics, from pharmacies, whatever it may be. It's the heroin maintenance programs you now have in Europe and Canada, something that Australians once led in talking about. I think those are two very pragmatic policies that could result in less death, less disease, less crime, and less waste of taxpayer money.
But you are talking about substances here that can harm people physically and mentally, can kill people. How do you ethically overcome the idea of legalizing them?
Trying to create a drug-free society makes no sense. That there's never been a drug-free society, there's never going to be a drug-free society, that the real challenge for us is not how do we keep these drugs at bay, how do we build a moat between these drugs and our children. The real question is, how do we accept the fact that these drugs are here to stay, and that the real challenge is to learn how to live with them so they cause the least possible harm and in some cases the greatest possible benefit.
What do you do, say, when it reaches the point where there's the first death of someone who was a registered heroin user, so essentially the government has, if you like, provided the drug? What happens when the first person in that situation dies?
Thousands and thousands of people are dying of overdoses, right, of heroin overdoses, of pharmaceutical opiate overdoses. If we set up a legal program like they now have in the Netherlands or they have in Germany or Switzerland or England or Denmark or Canada, so far, by the way, there have been no fatalities in those programs. But if there was a fatality, I would say that would be one fatality in a program which has saved hundreds of lives, saved taxpayers millions of dollars, reduced the spread of HIV and Hep C. It would be unfortunate, but the odds are that that person likely would have died if that program had never existed in the first place.
We're told that drugs are very easy to get now. If they're legal, does that mean they're going to be even easier to get and therefore more people will try them?
Well, I know at least in the United States, that there are now 3 surveys in which teenagers say it is easier to buy marijuana than it is to buy alcohol. So if ever there were an indictment of the current marijuana prohibition policy, that seems to be it. I mean, if marijuana were legalized, it's not going to make it more available to young people because they already have easy access. What I'm saying is not let's have a free-for-all. What I'm saying is not let's eliminate regulations. What I'm saying is let's regulate this stuff to reduce the harms associated both with drugs and with our drug control policies. People make the mistake of assuming that prohibition represents the ultimate form of regulation, when in fact prohibition represents the abdication of regulation. It means that whatever you don't effectively prohibit is left in the hands of the criminals. What I'm interested in is a sensible, intelligent, tough regulatory policy that reduces the harms of drugs and that also reduces the harms of our failed prohibitionist policies.
Californians recently voted against legalising marijuana. What does that tell you about where the public debate is, what the public view is at the moment?
I and my organization, the Drug Policy Alliance, were deeply involved in that campaign. We didn't start it, but we played a major role. And I have to say, I never expected the initiative would get 46.3% of the vote. I was prepared for much less than that. But if anything, the nature of the debate around legalizing marijuana has been transformed in the last 2 years. 2 years ago, that debate was considered a fringe issue. Now it's a mainstream political issue. By and large, what you see in the United States is a growing sentiment that although marijuana may not be the safest drug for everybody, that we're better off taxing it, controlling it, and regulating it. And that arresting 800,000 Americans a year, over 40% of all of our drug arrests for marijuana possession, makes no sense.
Now, while you're here in Australia, you're going to be speaking to people behind the scenes, no doubt, police, medical people, maybe politicians. Do you have a sense that they want change?
My sense is that the number of people in Australia, especially in the upper echelons, who privately believe it's time for a different policy, it's growing. It's true all around the world that there's a growing disparity between what elected officials and other prominent individuals say publicly and what they'll say privately. What's beginning to happen is that more and more people are finally beginning to say publicly what they would only previously say privately. Look what just happened in Mexico, where not just the current president, Calderon, said, okay, we need a debate on legalization, but his predecessor, Vicente Fox, said, that's the answer. And his predecessor, President Zedillo, said we need a bigger debate. So what you're seeing is people beginning to cross over from expressing themselves privately to expressing themselves publicly. I think we're going to see that crossover happening in Australia in the next year or two as well.
Do you understand that for a lot of people that big stumbling block is the fact that these are substances that can cause psychotic episodes, can cause potentially schizophrenia? Legalising something like that troubles people.
Well, I think once you accept the reality that these drugs are here, whether we like it or not, once you accept that we have to find ways to better control them and to minimize their harms, then you begin to accept that criminalization may not be the best way to deal with this. You know, I remember there's a Dutch scientist who was one of the first ones who showed that there may be some link between heavy use of marijuana at a young age and premature onset of schizophrenia. And somebody said, so what does that say to you about legalizing marijuana? And his response is, it says to me, that's why we have to legalize. That marijuana, while it may be safe for most people who use it, it's too dangerous to be left in the hands of the criminals. We need to bring this above the ground where it can be effectively regulated in a responsible way. We can't rely on the criminals to effectively regulate substances which can be as dangerous as these are.
Is there proof that your model would work?
There is proof from abroad that, for example, decriminalizing marijuana and allowing people to obtain it legally for medicinal purposes is not associated with any great increase in use. There is overwhelming proof published in the scientific journals that allowing committed heroin addicts to obtain their heroin legally from a legal clinic does reduce addiction, disease, crime, saves taxpayers money. overwhelming proof. There is proof now coming from Portugal. A wonderful report out just this week in the British Journal of Criminology by Alex Stevens that Portugal's policy of decriminalizing possession of all drugs has not resulted in an increase in drug use, but it has resulted in a reduction in crime, reduction of HIV, Hep C, and other drug-related ills. So there's powerful evidence. The thing I'm at a loss to understand is Australia, which 20 years ago took the lead in the world in saying, let's have a heroin maintenance trial, and then abandon it. And now 7 other countries are doing it, and some of them have it as a matter of national policy. And in Australia, you still have politicians saying it would send the wrong message, as if the right message is let those people die, rather than institute a policy which has been proven to work in a half a dozen foreign countries. That I don't get.
Ethan Nadelmann, thank you for speaking to us.
Thank you very much.
Some provocative views there on a very controversial subject.